Yesterday, Jake Evans suffered a brutal hit that knocked him out by Jets Scheifele. Now, if you guys go back to Game 1 of Toronto versus Montreal, I actually covered the John Tavares head hit right up here, and that one really shook both the teams. So it's really unfortunate that we're seeing a second hit of such a bad magnitude. Let's talk about this hit in more detail and what was done on the ice. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. Be sure to like and subscribe if you want to stay up to date. For now, let's go back to reviewing the injury. So the Jets and the Montreal Canadiens just started Game 1 of their series, and when I woke up this morning, I saw a replay of a brutal hit against Evans, and more particularly, it was how he was acting when he went down. Let's review the actual hit and discuss what the medical team did, as well as the fact that he didn't actually end up going to hospital as per current reports. So this is the best view of the hit against Jake Evans by Scheifele, and as you'll see, he's coming down here. He actually makes the goal, and this goal solidifies Game 1 for the Montreal Canadiens. But what he doesn't realize is because his head is down, Scheifele is coming from the other end of the ice, full speed ahead. And actually, if you look here, it's almost like the shoulder impacts the head, and he completely gets knocked out. What's more worrisome as a doctor here is he's got this forced flexion, lateral flexion of the C-spine. So that's what we're worried about. If you look at the C-spine, so this is kind of looking at the back here. First off, I wanted to let you know, we have the greatest range of motion in our rotation and flexion and extension. We actually don't have much in terms of lateral flexion. And it's just the way our cervical spine was built. Him falling head first, cranking that out, there's a few things that we'd be worried about. Number one, fractures. And these fractures can cause damage to the actual structures inside the bony bodies, which is the spinal cord. So that's the most important cord in our body for neurological function. And then you also have nerves coming out at different levels, like your C1, C2, C3 nerves. So, when you have a lateral flexion, you compress all of these areas here because that head essentially moves this way. And you can have burner stingers, long-term sequelae. So this is why it's so important once you see a fall like that as a doctor to stabilize the C-spine as well as assess for head injury. Now, when I initially looked at the actual hit itself, it really did appear that Evans was potentially having post-head trauma-like convulsions. They weren't general. They didn't look classic for a seizure, but he was moving. Looking at this again, though, it actually seems like he was probably coming to and trying to get up while everyone was collecting around him. The one thing that I did want to mention that I found pretty unfortunate is that, first off, hats off to this Jets player who's protecting him while these guys are getting into a tiff on the side for this hit. But to be honest, this guy, Evans, is out cold on the ice, unable to move. And I just thought it was pretty unsportsmanlike for these guys to be fighting right on the side of it. Like, take it away, protect your players a little bit better. Make sure that this guy is taken care of before you guys deal with each other. So when it comes to what happens on the ice now, we always talk about our ABCs, which is airway, breathing, circulation. But when it comes to trauma, we think of CABCs, right? So that's C-spine, because if you don't really stabilize the C-spine, you can get acute paralysis, you can stop breathing, depending on where the damage is. So, C, so you always get someone at the head stabilizing the C-spine. You ask the patient or the player not to move. If they're face down, you actually have to bring them face up while stabilizing that spine. So it can get quite difficult to do so, just to make sure you have access to now the airway, the breathing, and the circulation to make sure they're nice and stable. Now, as you can see here, they actually already flipped him, the medical team. And what they have here, they have this type of, so this one doesn't look like a scoop device itself. There's two types of devices. You either have a flat board, so you have to do a bit of a log roll to get the patient on there to keep them safe so that they don't move. The other one that some of the places will have is, it looks like this, but it actually opens up in the middle. So you can take both pieces and you can scoop the patient up, which is super easy when it comes to working on patients on the ice. Then as you can see here, they've essentially put him on the stretcher and taken that board, put him on the stretcher. They're using different types of, they're pretty much seatbelt-like materials to make sure that he doesn't move. But the most important thing that they're doing is they've placed pads along the sides of the head, and that allows him to avoid kind of any undue C-spine rotation. With an injury like this, it is a C-spine injury until otherwise proven. He lost consciousness, and he also completely impacted the spine in a pretty worrisome method. Now, reading up on this case this morning, it seemed like Jake Evans didn't actually go to the hospital, but was in his room. So obviously the medical team was not worried. Now, I mean, there's multiple factors at play. You know, with somebody who's got a hit like that, with a decreased, like who's completely lost consciousness, you would definitely be worried about a head injury and a potential brain bleed. You know, these people would arguably, you could argue that, you know, he could have earned himself a CT scan of the head. So if the medical team was reassured that he came to, his neurological exam was otherwise normal, so he was moving things, he had no numbness or tingling, and he was talking to you completely, then it could explain why they went back to the hotel. But I would rest assured he'd probably be monitored very, very closely at that point. Now, when it comes to the C-spine, normally with the C-spine trauma itself, we have something called the C-spine rules I'm going to attach up here. And essentially it looks at like dangerous mechanisms, it looks at age, and it looks at whether or not you have numbness or tingling in the extremities. So these are things that we would look at. Now, when you really hash into the dangerous mechanisms, you know, Jake Evans really didn't fit those, but when you cover sports, a lot of this stuff is a little bit more, it's not black and white because it doesn't really fit into what these scoring systems are. You take a look at that. To be honest, as the doctor on the sideline, I'd be worried about that being a dangerous mechanism and potentially getting imaging of the neck at that point in time. These get really hard to evaluate if people are out, can't talk to you, and a little bit incoherent. You can't ask them questions that are important. So, you know, can you feel all your limbs and so forth? I can't fully understand what went on behind the scenes to have Jake Evans back in the hotel room. Whether or not he went to the hospital, had imaging, and came back, we don't know, and I don't have that information right now. But him being in the hotel room does mean that, you know, any of the acute things that we were worried about are likely not there, because he would definitely have to be admitted to hospital for that. It doesn't go without saying, though, that he will likely be taken out on concussion protocol. And when he returns, we don't know. Now, to be honest, Tavares was back on the ice a few days after his injury. Unfortunately, Jake Evans has had a few injuries like this, last one back in 2018, where he was completely off the ice, or he was stretchered off the ice. So, you know, the more head injuries you get, the longer it takes to recover, unfortunately, and the worse the sequelae long-term if you don't recover completely. So it's going to be a touch and go when it comes to when Jake Evans can come back to play, which is unfortunate because, I mean, he pretty much scored the game-winning goal. If you have any questions or comments, leave them down below. If I get any more information on Jake Evans's status afterwards, or whether or not he needed to go get imaging or admitted to hospital, I will make sure to put that down below. If you like this video and want to stay up to date on more videos I do in the future, please like and subscribe to my channel. For now, that's all.